First this morning, a new round of COVID-19 booster shots is out and available. So who needs to get one and when? And while we're talking about shots, this is the time of year doctors are inundated with those back-to-school visits and the vaccine rush. Joining me now is the commissioner of the Connecticut Department of Public Health, Dr. Manisha Jutani. Dr. Jutani, thank you so much for being here. Let's start with the COVID boosters. What's happening now that's different? What do you want people to know?
Well, thanks for having me, Eric. And there are a few very key things for people to know. Whether you've been vaccinated or not, at this point in time, we know that vaccinations are the #1 way to protect us. And what's new with the new vaccine that's out is that it is a bivalent, meaning that it has two components, the original vaccine plus Omicron-specific components, which are going to be best at not only keeping you out of the hospital and having severe disease, but also protecting you more so from getting COVID at all. And these boosters are available, Pfizer for those 12 and older who've already had the primary series, and Moderna for those 18 and older, again, those who've had the first two shots. If you've had your first two shots and it's been at least 2 months, you're eligible for this booster, whether you got a previous booster or not. And so everybody over the age of 12 is eligible for this booster, and I would encourage people to go out and get it.
We saw that split the first time boosters came out saying, okay, first we're going to do immunocompromised folks and maybe some first responders, things like that. Is this one now, even if you've already gotten one booster, as long as the time has passed, everyone should get one right now?
That's right. If you've passed 2 months from whatever your last shot was, you're eligible for this shot, and I really recommend people go out and get it. And you may wonder why. Why am I pushing this so much right now? We know that the winter season, respiratory viral season, is when we see all of these viruses go up and case counts go up. We've seen our last 2 winters be the time that COVID circulates the most. We see the beginning of that with our COVID community levels. These are the levels that tell us how much burden is on our healthcare system. And we have 7 of 8 of our counties in the state now in the yellow category. So there are 3 colors, green, yellow, and orange, and 7 of 8 are up to yellow at this point in time. So this is going to be our way of making sure that we can protect our healthcare system to be able to care for people with COVID and for all the other things that people have been suffering from always, but even more so in these last few years. And this is going to be the way to protect kids and keeping them in school. That is the #1 place where children learn best. And the less virus we have circulating, the more likely they'll be able to continue with in-school, undisrupted education.
I want to talk about school in just a minute because it's on so many people's minds. But I want to ask you a couple quick ones, just questions that we've heard about the vaccine. Also, this time of year is flu shot season. Can you go in and get both in one day? Does it matter? Is that something you might want to talk to your doctor about?
So I would talk about it with your doctor. You are allowed to get both shots on one day, but one thing you could do if you don't want to get both on one day is maybe go in and get the COVID shot now, since it's been rolled out. Flu shots are rolling out as well. You could wait a couple weeks and get that after. It's totally fine to get both shots on the same day. So if you prefer to do that, that is also an easy way to get both done. And I think that what we want people to remember is that these shots are really going to be the way to protect yourself from getting infected and transmitting it to others who may be more vulnerable in your family as well.
We've talked about this before, I think maybe way back when we were first starting to figure out about all these vaccines. But does it matter if it's a Pfizer or Moderna or what you got before, if you have 2 of one and 3 of the other? Does any of that matter, or should people just get whatever shot they can get?
You should just get what you can get at this point. There are people who've told me that they've gotten either Moderna all throughout or Pfizer all throughout, and they want to stick with it, and that's fine. That's totally fine. But you don't need to do that. I would say at this point, just get what you can.
All right, let's talk about school a little bit. I know, keeping on the COVID theme, as kids head back to school, some different guidance was given to schools, but also to parents about when you should keep your kids home, about close contacts, things like that. Where do we stand right now with COVID in schools in Connecticut?
So this is our first season of school where we're really starting out as close to normal as possible. And what we have advised schools and families is that if you have a mild respiratory illness, so a runny nose, a mild cough, no fever, if you have fever, you have to stay home. But if you have any of those things, we have supplied thousands, millions of tests are in the state for COVID, where a family can test their child, and if they're negative, What we are recommending to schools is that the child be allowed to go to school and just wear a mask to be respectful of other children. And if they have symptoms that persist, they can test a second time. But if they remain negative, to continue going to school. We want to try to keep as many kids in school as possible who do not have COVID.
Now, we know even the late arriving districts, the late starting districts are back in class now. Are you monitoring that? Is that a concern? I know anecdotally, the baseball team that I coach had a couple kids test positive over the last week. One of my son's friends tested positive. So are you hearing more cases anecdotally, or what do the numbers show?
So we are just starting to get our reports in from schools. So we have an online data portal where schools report in the number of cases they have, and what reports we get are posted on this site. And so it's a little bit early, I think, for us to really have a sense of that, because we're waiting for that data to come in. It gets updated on a weekly basis. But I do think that it's not surprising that as the fall is taking hold, as kids are back in school and engaged in full activities, which they have not been fully engaged in the fall for the last couple of years, it's not surprising that we will start to see more cases like this. So again, for our children, we know that for our 0 to 4-year-olds, we have about 10% that have gotten one shot. Our 5 to 9-year-olds, about 50%, and the percentages go up. But for our youngest kids, we still have a ways to go in terms of getting children immunized to COVID. And I really encourage parents to do that, because it's going to be the #1 way you can keep their kids in activities and in school.
We talked about this as we were tossing to you. It's also just the time for kids to get those well visits with their pediatricians. And I saw an interesting statistic that the percentage who were vaccinated against all different sorts of things had dropped from 96.3 to 95.2. I'm looking at it saying, well, that's not that big. But I guess when you multiply by lots and lots of kids, are you concerned? What's the message for parents about that?
For many parents over the last couple of years with COVID, they may have fallen behind in terms of their routine vaccines. And it's just a matter of having experienced so much conflict and so much disruption in life. It's not always that people didn't want to get those vaccines. So what my main message to parents would be get back in the routine of all the things you would do for your children going back to school. Get back on that vaccine schedule. We've seen the threat of what not being vaccinated can cause. We saw that case of a vaccine-derived polio case in New York, with wastewater showing polio circulating through 3 counties in New York. Thankfully, in Connecticut, we do not have any polio in our wastewater. I hope that will continue to be the case. We are continuing to monitor that with the CDC. But it's just a reminder that these infections, in order for them to stay in check, we need to keep our kids on those vaccine schedules. They are there for a reason, and we have so much to benefit from them by staying on track.
Well, certainly as those visits come, the kids don't ever want to get the shots, no matter how important. But then you hear something like polio and you think, geez, maybe it's good if we get that all taken care of. Good advice for parents and anybody who might need a booster. Dr. Manisha Jitani, the Commissioner of the Connecticut Department of Public Health, thanks for being with us here on CT22.
Thanks so much for having me.